GoldenDent.
We have edentulous area in teeth number 4 and 5. Now, I'm a big believer, if we're going to do this, let's get intense anesthesia of the soft tissue. Remember, bone is not innervated. Bone has no pain receptors in it. Nerves run through bone, but not in this area. So we just want complete anesthesia of the soft tissue. Another great tool, another wonderful tool that I use to make my implant surgery a little easier for me is something called the MD Guide. And we purchased these MD Guide, mesial distal guide, from Golden Dental Solutions here in the Detroit area. And it comes in a kit, and you can see it has a pilot drill at the end, and it has cylinder, a round cylinder, which duplicates the width, the mesial distal width of the tooth you want to replace. One thing that's very important is to be able to virtually place the implant before you ever touch the patient, and to imagine what the teeth are going to look like prior to surgical placement. I find this to be an excellent tool to help me in determining proper placement. Oftentimes when we're doing this implant surgery, we have a tendency, if we're freehanding it, to maybe put the implant too close to the tooth. Now remember also that we have to have a minimum of 2 millimeters between the outside of an implant and the outside of the root structure of a tooth. In between implants, we want a minimum of 3 millimeters. Those are minimums. So we have a space, and we kind of have to determine what size teeth we're going to be able to put in this situation. We then have the same size cylinder post that will engage into that preparation, and I tie some floss around it so we don't lose it. And you can start to virtually see what that tooth is going to look like prior to really moving any further. So you're able to position the patient and the teeth correctly. Then we're going to do the same thing with the second tooth, splitting the difference. And we're using the pilot drill, and then we'll set the cylinder in place, and we'll make sure that we're happy with our positioning. Minimum of 2 millimeters from adjacent teeth and 3 millimeters from adjacent implants. So you can see here how the final crowns will really be positioned correctly in that edentulous ridge.